Good morning, everyone, and welcome to the region-wide Community Information Exchange Milestone Celebration. I'm Waldo Michaels Carrasco, the director of the Center for Health Information Sharing and Innovation at the Illinois Public Health Institute. I am pleased and proud to share that we're about halfway through the research and design phases of the CIE's development, and we're excited to have you all here today to celebrate the progress that we've made together. We'll be answering questions during the question and answer portion of today's presentation, so we'll ask that you please enter your questions through the Q&A icon below. We'll also be posting all of your questions and answers, including any that we may not get to during the webinar, to the project website in the coming days. We ask you all to please be respectful and curious and kind. And finally, this event is being recorded for those who can't join us today and will also be posted to the project website with all the other materials. So let's take an overview of today's agenda. Today, we'll be highlighting the key achievements and future plans of the Community Information Exchange, or CIE. And we'll hear from various speakers about the progress we've made and the partnerships we've built and the next steps in our journey. I want to introduce today's speakers and my incredible colleagues who are leading this work. Our senior program staff here at the center include Catherine Gillis, who leads all our research efforts, Rashida Balgun, who aside from providing leadership on all kinds of aspects of the project, also leads our pilot planning work group, and Ellen Cluett, who leads the legal framework and governance work group. In addition, we have our amazing consulting partners, starting with Joy Ross and the team at Apex Direct, leading our outreach efforts, Ed Stellan, leading our business model and sustainability work group, and finally, Laura Nixon, leading the work group to help us identify the CIE's technical and data standard requirements and design. In addition, we really want to extend a heartfelt gratitude to all the partners, and especially our partners with lived experience who have contributed to this initiative. Your insights and support have been invaluable. Also, we want to give a special thanks to Meaningful Marks for translating our research into the journey maps artist renderings you'll see during today's presentation. But in order to celebrate our progress, it's essential that we understand how this work began. So to take us through the project origin, I would like to introduce my colleague, Rashida Balgun.
Thank you, Waldo. Hello, everyone. Again, welcome. My name is Rashida, and as Waldo mentioned, I am a senior program manager here at IPHI for the Center for Health Information Sharing and Innovation. And I also get to work with an amazing team on this incredible project. Since we have a fully packed hour for this event, I'm going to provide a brief background overview of how we got here, and also encourage you to visit our project development website for more detailed information later. So IPHI's grounding for this work has been years in the making. The CIE emerged as a key recommendation for the city's System Change Collaborative to improve the health of people experiencing homelessness. And the 2022 Equity Fund Task Force report during the height of the COVID-19 pandemic. IPHI was selected by both the city and the county as the lead consultant for this work due to our extensive expertise at the intersection of community information exchange and homelessness. IPHI cooperates with data across sectors for health initiative, which enhances data sharing across health and social service sectors. Additionally, the impactful work done by IPHI's Alliance for Health Equity team, a collaboration of over 30 hospitals addressing health equity issues, underscores IPHI's capabilities. IPHI facilitates multi-stakeholder collaboratives on housing, homelessness, healthcare, and more, and has led efforts like the Systems Change Collaborative to improve the health of people experiencing homelessness. So this extensive groundwork and collaboration have set the stage for significant progress for the CIE, and I am thrilled to share some of our key achievements to date. First, let me say, the CIE is not just a project. It's an ongoing commitment to systemic change. Rooted in equity and community co-leadership, we could not have achieved this without the dedication and sacrifices of everyone who took time out of their busy schedules to meet with our team, some numerous times, and join work groups, all in the name of health and racial equity. Since we've begun, we've conducted over 100 conversations with a diverse range of partners, including individuals currently experiencing homelessness and those also with lived experience of homelessness, service providers, community-based organizations, and the homelessness service sector, as well as healthcare partners and organizations. In addition, we've convened 5 CIE development work groups, with the 6th one launching in the coming week. 2 of the work groups were lived experience work groups in alignment with our commitment to equity and community co-leadership. You hear more about these roles of the specific work groups later on in this presentation. In addition, the pilot planning work group identified the first 2 pilot use cases. This was no small task for this pilot planning working group, giving the broad category of people experiencing homelessness that we were assigned to develop the CIE. These use cases had to meet certain criteria, including geographic relevance, meaning that they were observed both in the city of Chicago and surrounding Cook. They also needed to be cross-sector collaboration, either currently or a necessity for it. This is just a small sample of the criteria that the work group had to sort through in order to arrive at the potential use cases for the CIE. The 2 identified pilot cases are medical respite and shelter-based care. These use cases emerged from our many conversations that continuously highlighted specific groups navigating through the homelessness service systems, whose services included shelter-based healthcare or medical respite care, and on some occasions, both. The development of use cases is a discussion that we could literally have for hours. So if this is something that is of interest to you, please feel free to reach out to the CIE team later, because of course the show must go on, and I'm super excited to introduce to you my colleague, Dr. Gillis, who prefers Catherine. And Catherine is going to provide you all with a more in-depth snapshot of like what is included in these engagement numbers that you see before you.
Thank you, Rashida. So CREs are community-based efforts, and they're designed to amplify existing collaborations and address community-identified needs. So over the last several months, we've been talking with community members to better understand the current landscape. So how is data currently being shared or not being shared between health and homeless service providers? What's working well? What could be improved? And what sort of technologies are currently being used? We began this process by having a series of conversations. In addition to our one-on-one conversations, we distributed a service provider survey through the COCs and DFSS to gain a better understanding of current data sharing needs and existing collaborations. We also attended 23 community meetings to make presentations on the CIE and answer questions. And we held listening sessions with homeless service providers and people who have experienced homelessness and who have expertise in navigating the homeless service system. This chart breaks down the conversations that we've had so far. Over 100 conversations have been had with people with lived experience, social service providers, government representatives, healthcare providers, funders, researchers, and organizations that have been doing systems coordination and cross-sector data sharing work. Joy Ross will go into further details about our work with people with lived experience in just a few minutes, and I'm going to highlight some major themes that we've heard from service providers. So in our conversations with service providers, we've gained valuable insights into the challenges faced by organizations, as well as priorities for a region-wide CIE. We've heard that there's a desire for greater connectivity between social service providers and between healthcare and social service providers. And this connectivity can improve services in two ways. One, it can increase the knowledge of services that are available, as well as creating access to a wider network of social service and healthcare providers. So, for example, many social service providers express the need for greater access to dental or behavioral health services. And two, greater connectivity could also result in strengthened relationship between organizations so that our referrals can be better coordinated. We've also heard many stories about the time and effort that service providers and people experiencing homelessness are putting into gathering eligibility documentation. This includes birth certificates, social security cards, and disability documentation. Oftentimes, this information is being tracked down multiple times by multiple providers because it's not in a centralized place. There's a desire for easier access to this information so that providers can better assist people experiencing homelessness as they access public benefits and supportive housing options. Third, generally, we are hearing overall excitement and support for increased communication and data sharing. And at the same time, many providers express the need to protect privacy. We've heard that it's very important to establish a process that will determine what data should be shared and who should have access to that data. We also know that it's important to ensure that those who are receiving services have control over how and whether their data will be used. Fourth, we've heard that a CIE needs to be adaptable. The people who will be served by the CIE have a diverse set of needs and priorities, and the CIE needs to be flexible to address a wide range of circumstances. For example, people who are undocumented experience high barriers to accessing services. Families with children need whole family supports. And some people may have additional privacy concerns, such as those with an HIV or AIDS diagnosis. And then finally, and last but not least, we heard that the CIE needs to be easy to use. We know that many providers are already entering data into multiple systems, and another system that requires more data entry is not desirable. So as we continue our conversations, we are adding to and refining these themes, and these themes are informing the work of our pilot, technology, governance, and sustainability work groups, which we'll hear more about shortly. But now I'm going to pass it over to Joy, who's leading our engagement efforts.
Thank you so much, Catherine. And as Catherine pointed out, engagement really has been foundational to this entire project, and it will continue to be so. I would like to acknowledge and thank the organizations that you all see listed on the left, from All Chicago to the Boulevard, Best Plus, Revive, and Suburban Cook Lived Experience Commission, because they were instrumental in connecting us to people who have actually experienced homelessness. And so our entire effort in terms of engaging has been people focused from the beginning, and it'll continue to be so. And what I mean by that is we have modified and been flexible in our methods to meet the needs and engage with people the way that they have requested to be engaged. So what that's looked like is a variety of methods, including over 60 one-on-one conversations, small group discussions, in person, virtual, and even old school, like hopping on the telephone and calling people if they said they would prefer that method. And we've also organized so far 2 lived experience work groups. And one of those is focused primarily on helping us understand their paths navigating through medical respite and service-based care. And the other work group is going to be launching next week, and they will solely be focusing on consent and sort of letting us know, what do they want that to look like? What don't they want that to look like? And so I want to share and just spotlight for you all a minute their voices, things that we have heard as we've been engaging with the lived experience community. What's interesting to note, if you look at, in their words, those quotes across the top of the screen, essentially, people with lived experience just simply want to be seen, heard, understood, and respected, which we all do as human beings. And what's interesting about the quotes along the bottom is they're asking for things that clearly the CIE can help address. So that's very encouraging. And I want to just pause a minute and thank all of the lived experience work group members and the people who aren't serving on work groups, but who participated in one-on-one conversations. Many of them are in the audience today. So I just want to acknowledge you guys and thank you. And I have the privilege to be able to bring on stage so that you can hear in their own voices two of the people who are serving on our work groups. And we have with us today Maxica Williams and Joanna Walker. And as Adrian is bringing them up on stage, I'm just going to introduce them briefly. So Maxica is a stage 3 cancer survivor who has provided valuable insight, not just on our CIE lived experience work group, but she's actively engaged in advocating to change conditions for people experiencing homelessness. Maxica is a grassroots leader and board president of the Chicago Coalition for the Homeless and also serves on the patient brigade at UIC. And we have Joanna Walker, who is just a rock star in her own right, mother of 5, who found herself having to navigate homelessness shortly after her 2-month-old passed. And in that time, she navigated her own way through homelessness and out of homelessness, and has since become an advocate for unhoused youth and adults, and serves full-time, works full-time at the Christian Community Health Center, and is the proud winner of the 2024 Justice Circle Award for her youth advocacy work. So I'm going to ask each of you, and we'll start with you, Maxica, and then hop over to Joanna to just share with our audience briefly what has it been like for you serving on the lived experience work group, and how do you think the CIE can help people who are actually experiencing homelessness? Maxica?
Good morning. Happy Friday, everyone. It's been, for me, working with the Community Information Exchange Project, having an experience of an expertise of lived experience and being homeless and housing insecure. It means having the ability to be open, honest, and given the issues and barriers that occurred or happened when I was homeless and my children, and ensuring that there's a connection that continues between the CIE and the lived experience community to make sure that our voices are heard and we're always at the table, because as society changes and there's issues financially, housing insecurity comes about, and we want to make sure those that know most and best about the processes and issues and barriers are at the table so that there can be change and there are more resources and tools designed and given to them.
Thank you so much. Well said. And Joanna, can you just share your experience and how you think the CIE can help people experiencing homelessness?
I feel like my experience has been one to tell stories about. Today is not the day to go into detail, but being a part of these work groups have made all the difference to those who have lived through or survived what I've been through. It has given me, myself, being a part of these work groups has given me the opportunity to speak on behalf of others and advocate on their behalf of the folks experiencing homeless throughout the city of Chicago. I feel like CIE can make the difference in the lives of people experiencing homelessness, to give those people who feel like they have no voice the opportunity to have a say and a voice on what makes them successful, and putting the action behind it, finding out what stability looks like for them and how they want to be successful. And I have been so honored to be a part of CIE, and I'm looking forward to what's to come in the future.
Thank you so much, Joanna and Maxica. You both sort of double clicked on the need for and the importance of your voices continuing to be heard. And we absolutely are looking forward to having your continued involvement and the full involvement of both work groups as we move forward. As Rashida mentioned earlier, we, in addition to the 2 lived experience work groups, have 4 technical work groups. And so now we're going to hear first from our fearless project leader, Rashida, who's going to give us a little information about the pilot planning work group.
Thank you, Joy. Thank you, Maxica, and thank you, Joanna, for sharing your stories. So let's talk about the role of the pilot planning work group. I had the pleasure of launching the CIE's inaugural work group. So imagine my trepidation. This is like the very first work group to launch for the CIE, and they did an amazing job. So I am excited to share the significant accomplishments of this work group. The PPWG, as we fondly call it, consisted of 2 work groups, as Joy just mentioned. So there were folks in the homelessness service sectors, as well as the lived experience work group. And both have played a pivotal role in laying the groundwork for the success of our community information exchange. The pilot planning work group was the first of our work groups to launch, as I said, and has been crucial for laying the foundation of CIE by gathering insights from the community and key partners, developing the initial use cases, and identifying the gaps in current services. The PPWG has set us on a path towards creating a seamless and efficient system that truly serves those facing and experiencing homelessness. The lived experience pilot planning work group, many of whom are here with us today, as Joy just mentioned, worked in parallel with the other part of the pilot planning work group. And I just want to thank everyone, again, that was involved, especially in the lived experience work group. This was a new adventure for a lot of them. They were very forthcoming and vulnerable with sharing their insights and their experiences. And we're just so incredibly just happy for their contributions. They're invaluable to this initiative. Some of the key objectives of this work group were, as we mentioned, community engagement, your insights and recommendations. And when I say I mean a lot of people here on this call today. Many of you we've engaged with, and it's been foundational in shaping the work group's approach. By engaging with key individuals in the homeless service sector and their partners, we were able to gain a deeper understanding of the work that's being done, incredible work that's being done. And then the primary objective of the other primary objective of the work group was to develop the initial use cases. I think I spoke briefly on that earlier. And so what this involved was mapping out the client journeys and the organizational workflows to better understand how individuals navigate the system, and then how these organizations are interacting within this ecosystem. You'll learn more about that process in a bit as we introduce those client journey maps to you. In addition, the work group also identified opportunities. So additional use cases are forthcoming. We also aim to identify opportunities where the CIE could improve partnerships, where there are organizations that should be connected or in some sort of collaborative relationship with data sharing and providing continuity of care for those that they are servicing. And also by pinpointing these opportunities, we're able to enhance the overall effectiveness and efficiency of the service delivery system. So one of the things that occurred during this process when we first started out, it's like who we needed to talk to. And so before we move on to the client journey maps, I'd like you to hear from one of our esteemed partners and work group participants. So when we began our discussions for the CIE, whenever medical services or within shelters were mentioned, there was one name that came up time and time again. People would always ask us, have you all spoken to Dr. Huggett? Or, you should really speak to Tom over at Lawndale Christian Health Center. His knowledge and passion for this work makes him highly revered among his peers and within the community. And hearing his name mentioned repeatedly in our conversation was actually a little surprise to me, as I've had the pleasure of working with Dr. Huggett prior to the CIE. This includes the recent update of the standards of shelter-based care alongside Mary Tornabini from Heartland Health, and then the CDPH behavioral health teams. And then the Systems Change Collaborative, which highlighted how the CIE could help improve the health of those experiencing homelessness by allowing increased coordination and services. between multiple providers and sectors. So when it was time to begin forming the work groups and making recommendations for the work group, absolutely, Dr. Huggett was my first recommendation. And we were beyond grateful that he accepted. And with that, I would like to introduce you to Dr. Huggett. Thank you, Dr. Huggett, so much for joining us here today and your dedication to this work. I would love it if you could please briefly share with us what your experience has been participating in the CIE work group and how you believe the CIE could possibly add value to your work.
Thank you, Rashida, very much. And just want to say that I've really valued participating in the CIE work groups because I really believe that the folks that our team has served in more than 20 shelters in Chicago over the last 30 years, we really continue to hear from our clients, patients, guests of the shelters that they expect us to help them get things done. They actually are kind of surprised when we tell them that, oh, we don't have that information. They kind of think that we already have that information, that we are already sharing information that will help them to achieve the goals that they are wanting, to achieve the housing that they wanting, to achieve everything that they want for their families that Maxica and Joanna really outlined previously. So I've really appreciated working with the work group. I think that we can improve our communication. So with our social services, with our healthcare, with our public health colleagues, with our housing colleagues, to really make sure that folks achieve their goals, to achieve the housing and the supports that they need to be successful with their housing, and to really move things forward. We've done this, we did this during COVID at Hotel 166, housing 132 people. We've done it through the accelerating moving events. I know we can keep on doing it again, institutionalize this for really, really good continued information exchange.
Thank you, Dr. Huggett, so much for sharing your experiences and your insights. Your contributions, along with those of all of our partners, are invaluable in shaping the future of the CIE and ensuring we create a system that truly, meets the needs of those experiencing homelessness. So we appreciate you.
Thank you very much.
Thank you. Next, we would like to delve deeper into our ongoing efforts and the impact that our community engagement provided us. So you've heard us speak of all of our conversations with our service providers and those with lived experiences. All of that information and data, lots of information and data, were collected to form a client journey map. And I'm going to introduce you to my colleague and the Center Director at IPHI, Waldo Michaels Carrascos. Waldo. Thank you.
Thanks, Rashida. So as Catherine and Joy and Rashida have shared throughout this morning's presentation, we've gone through extensive interviews and the work of the pilot planning work group to develop and use the cases of medical respite and shelter-based care, where those issues were identified as the priority issues to focus our initial work. The journey maps that were created by Meaningful Marks for us were based on the insight that was drawn from those individual experiences of moving through those systems, those individuals like Joanna and Maxica and others who have shared information with us, and providers like Dr. Huggett, who have been working within those use cases for years. They provided a visual representation, or I'm sorry, the journey maps provide a visual representation of the challenges, and therefore they also provide a representation of what the opportunities are within the homeless services system. And again, I think you heard some of our guests speak to some of those opportunities in our presentation thus far. It's important, importantly, they provided us with a visual tool to help us confirm that we actually and accurately heard and captured what those persons who have shared their experiences of moving through these systems have told us, as well as the perspectives of the providers who serve them. I will mention that if you would like more information on how the use cases were considered and developed, we'll be posting some of that information that Rashida shared with you and some tools that explain that approach on our project website with all the other materials. But let's take a look at some of the aspects of these maps. So as I said, there's a lot of information on these maps. Some of the more foundational information that was really important for us in developing targeted solutions, improving collaboration, and addressing specific needs identified came through the work that was done in the work groups, the interviews, and the community engagement that Apex Direct helped us with. These journey maps also helped us identify information, a great deal of information. And as I said, all of it won't be able to be covered during today's presentation, but the maps themselves in their entirety will be available on the project website for your deeper review. But let's take a look at some of these insights. The maps highlighted several critical areas or access points and processes within the client journey from both the client and the provider perspective. For the client journey path, we focused on understanding how individuals entered the system, how they accessed social services assistance, where they received and how they received medical care, and eventually how they exited the system. We asked service providers to describe the workflows in addition to which technologies they were using, the data that they were sharing, and who they were sharing data with. But most importantly, in addition, we also wanted to know who they wished they were sharing information with but couldn't today, or what kinds of data would be useful to have that they didn't currently have access to. We examined the same aspects for both medical respite and shelter-based care to get a comprehensive view on the journey. So you'll see that there are many common benefits for both of these use cases called out for both. As far as opportunities, the CIE conceivably would be able to introduce and support safe, secure, two-way data sharing integration between a greater number of health and social service providers. Because providers will have more information on where individuals have been or what kinds of services they have signed up for, the CIE will help them find missing clients who may be next up for a bed or a unit, but currently lost to the system because providers haven't been in contact with them. Providers will also be able to coordinate and build on each other's care plans, which is essential to improve efficiency and efficacy of the continuity of care. This would take place through an increased efficiency in not just the intake and the screening, but also the discharge workflows that a lot of organizations currently have or are currently working with. So what comes next? Well, our work group facilitators from the data, technology, legal and governance, and business sustainability work groups will discuss how their work groups are investigating these opportunities to build out the CIE, ensuring a comprehensive and effective support system. Let's begin with the discussion. Let's begin the discussion with Laura Nixon, describing the work of the Technology and Data Standards Work Group. Laura?
Thank you, Waldo. Good morning, everyone. My name is Laura Nixon. I am an interoperability expert and have been fortunate enough to facilitate the Technology and Data Standards Work Group for this truly amazing project. I'm really excited to update you on our progress with our work for the CIE. I am going to essentially outline our approach to developing this scalable modular technology solution that not only meets current needs for healthcare and social services, but also addresses critical data gaps through the creation of a longitudinal record. So our goal is to construct a modular system that supports a range of use cases, starting with our original use cases of medical respite and shelter-based care, and then being able to adapt to additional emerging needs as we go through the future. So we are aligning our technology with healthcare standards such as FHIR and HL7 to ensure that our system is interoperable with existing and future systems, crucial for long-term partnerships and collaboration. So to do this, and in order to create a robust CIE platform or CIE solution, we're focusing on some key components. Those key components start with an Enterprise Master Person Index, or an EMPI, with the record locator service. This will ensure that we have precise identification and tracking of individuals across different systems and care settings. We will also have an integration engine that allows diverse data types to seamlessly integrate into our platform, which will enrich our data, enhance our data richness. And it's very crucial to have this integration engine because there are so many different types of data that we will be putting together and needing to normalize. We'll have a terminology service that aggregates, normalizes, and deduplicates data, improving our data quality and usability, very crucial from the get-go. We'll also include consent management capabilities that will provide patients and providers of care with control over data and ensuring privacy and compliance. Additionally, it is our vision to include an ADT alerting network that will communicate in real time different events between care providers so that our service recipients are able to have the service delivery in a timely manner. So our care coordination platform integrates all of these different modular technologies to support efficient and coordinated care delivery across many diverse platforms and providers. So it's a large project and it's in a compressed timeline. So it's something that we are certainly modeling after other successful community information exchanges. And we also are really working to truly address the identified needs of the participants and the end users that will be using the community information exchange. As Waldo and Rashida and Catherine mentioned, there is a significant need identified by our stakeholders to address the lack of comprehensive data so that various sources are able to have a complete compilation of information for an individual when they're helping that person at that time. We are really taking this approach, this longitudinal approach, not only provides a fuller picture of a person's health and social situation, but it also enhances the ability to have predictive analytics and also personalized care planning. So our immediate goal is to send out the request for quotation that we developed in our work group to many different vendors to respond. We are sending that out in the next 2 weeks with the anticipation of hearing or receiving the proposals from our potential vendors by the end of September and starting to see demonstrations in that time frame as well. It's our intention to work with technology partners that can help us realize our vision. So it's going to be a system design process that truly is customized to the needs of the region-wide CIE. So I thank you very much for allowing me to provide you with this update today. And I'm going to now pass it over to Ellen to talk more about the legal and governance framework.
Awesome. Thanks, Laura. And so based on what we've heard from service providers and people with lived experience and what you've heard today, we've learned of ways that we can really enhance the way that we care for individuals going through this system, as well as the technology that works alongside this system and with these individuals. And it's really important that we are legally and ethically sharing data. And this is where that legal and governance framework work group comes into play. And the work group aims to develop recommendations around a legally compliant framework, governance models, and consent and privacy models. And keeping up with, the voices of lived experience that really ground us in this work. And as Joy said earlier, there is a people with lived experience legal and governance work group to help uplift these voices and experiences, to participate in and review the recommendations that come out of these work groups. And so the work group is exploring a large range of laws and regulations that are at play in this work, whether they're state, local regulations, or even regulations. And this includes making sure that the data we're sharing is legal, that we're sharing the correct information, and other issues like that. And so part of this work group will be developing clear data sharing agreements to ensure compliance with privacy regulations, focusing on secure data handling and protecting individual privacy. The work group will also help to create a governance framework. And if that's not something that you hear on a daily basis, it's really looking at and including the people, the policies, and the procedures around decision making. And that's the who, what, where, and how of the data. This will also look at beginning to develop the mission, the vision, and the values of the CIE. It will look at topics such as who's making decisions, what do governing bodies look like, what are different individuals' roles in this work and responsibilities. It includes establishing protocols for compliance and legal requirements with privacy regulations is also very essential. And again, this includes defining roles and responsibilities for things like data management and monitoring data usage to maintain accuracy and reliability. And then last and certainly not least, one aspect of this work is developing a consent model recommendation. And so this is somewhere that, the people with lived experience, their opinions and experiences traveling through the system is really, really valuable. And so consent is a key aspect to make sure that we're ethically sharing individuals' informations. This means looking at when data is shared and giving individuals the opportunity to view, change, or revoke their consent to share data. So we value those experiences of individuals about how consent is working right now, how it may not be working great right now, and how they want to see consent work in the future. And so this will create recommendations for a new process that will more equitably and efficiently capture consent. And so I know I ran through that really quick, but not only are the legal and ethical issues really important to the success of this project, but making sure that our project is financially sustainable to make sure that we can continue to serve our community and the individuals experiencing this system is really, really important. And with that being said, I will pass the virtual mic over to Ed Stellan, who is amazing and leading and facilitating the sustainability strategy work group.
Thank you. Thank you, Ellen. And thanks to everyone. Ed Stellan, very excited to be here today. I've spent over 30 years working alongside people experiencing homelessness as a service provider, and then organizing and leading services. And at Heartland Alliance Health, really sitting at the intersection of homelessness, and multiple systems, the housing system, behavioral health, healthcare, food and nutrition, and everything. So to see something like CIE is really, on a personal level, very exciting for me. I also am going to be very careful with our time because we do want to make sure we leave a good solid 5 minutes at the end for questions and answers too. So first of all, I want to just recognize the great work that's been done already, working, building on the voice and experience of people with lived experience, folks right at the tip of the spear delivering services. And that has contributed to our use cases. So from those use cases, as we understand, though, shelter-based care and medical rest for people experiencing homelessness, we see this as a toehold, a platform from which to build, expand, and scale a very comprehensive community information exchange. I want to also express our gratitude for our funding. We are funded, we have ARPA dollars, and we are using those ARPA dollars to really understand and build this platform, as you've heard so far. And that said, we know that ARPA dollars come with a time limit. So I know earlier Laura used the term, it's a large project with a compressed timeline, and that's exactly where we find ourselves. So in terms of the business model and financial sustainability, we've pulled together a business model and sustainability strategy work group that is populated by leaders from multiple sectors. So we have people who run government agencies, people who represent Medicaid health plans, people who work and oversee organizations in the community, all coming together to look at the business model from their perspective. We're also relying on them as leaders to help us understand the value propositions in the multiple sectors that contribute to the CIE. So again, just looking at my time. So the other thing I want to say is that we're not doing this in a vacuum. We've learned from other successful CIEs across the country on how they've built a business model, and they've built a glide path to financial sustainability over time. And we know from their experience and from our own collective experience on the ground in Chicago that sustainability means that we need to build a solution to the problems and challenges faced by leaders in multiple sectors, especially those leaders who have the capacity to invest dollars in the CIE, and that value proposition has to do things like improving efficiency in a sector or in an organization, increasing productivity, reducing costs, the cost of service delivery, and ultimately improving outcomes. So what we've done is we've identified a series of opportunity streams. So essentially, opportunities to generate revenue in partnership with leaders from various sectors. Those opportunity streams include healthcare, government, philanthropy, research. We know that in order to have an arrangement with folks to support the CIE going forward, we need to be not only be able to solve their challenges, but also make arrangements through. We can move forward too with this to the next slide. We need to have the mechanisms for payment, including memberships, fee-for-service transactions, contracts, grants. We're looking at all of those. And then finally, you'll see that we have a timeline. Now, as you've heard, we are very quickly building out this platform, but at the same time, we're already engaging in conversations with leaders from the multiple sectors to explore the value proposition. We've put together a value proposition for each of those opportunity streams, and now we have to vet those. We have to explore that in partnership with leaders from those sectors and hone those value propositions so that that can be transformed. So we have 5 minutes left, and I'm going to turn this over to Waldo at this point to bring us home.
Thank you, Ed, and thanks everyone. We really have a little bit of time left, but I do want to get to some of these questions that are in the Q&A. Some have been answered already, but for those of you asking about, technical communication solutions like direct messaging, the system should be able to, we are looking, as Laura described, for systems that are agile enough to be able to participate in that, if that's the preferred method for exchange. Questions about AI. People love talking about AI. Currently, we are more interested in a data exchange and improving those workflows. Certainly, questions around analytics and predictive modeling, as Laura mentioned, will be taken into account. And if through the governance process that Ellen described, if it's seen as something that would benefit the community and the work of the CIE, it certainly is something that we will look to have the ability to participate in. Also questions about, a lot of questions about technology, about the data model and whether the system will be cloud-based or not. We are looking we're investigating to see if cloud-based solutions would be possible and workable within this. So it is absolutely something that we're looking at. It's a great improved security and support for upgrading version technology. So we're definitely looking at that. The data model is currently under discussion, and this is kind of part of the work groups, the interviews, input from providers and systems users. And yes, the question about future use cases. The whole, everything that's been described is to explain how we're starting with these 2 use cases and trying to build out what other issues do these populations have that services like this could help coordinate. And then within those new use cases, what are other populations that weren't in the initial one? A robust CIE addresses all of the social determinants of health, or as many as the community can coordinate on. So as much work as we can take on over time to address as many social needs, coordination as we can, we will be looking to do. And we are, Ed and our work group, our sustainability work group, are certainly looking at things like Medicaid 90/10 funding to provide infrastructure and or ongoing support from CMS for information systems that support things like the Medicaid waiver or Medicaid payment programs. And as far as what professional opportunities for people with lived experience to help people with lived what kind of I think opportunities we will provide for people with lived experience to participate in the CIE. We would be happy to have those discussions. I think some of that has come up in our interviews and our persons with lived experience work groups up to this point, and we welcome those. Please, contact us with the contact information provided. We have another slide, I think, that has the contact information for the work group leads, as well as the website. There's a forum on there you can submit more questions to. We'll be taking these questions and answers, including them in an expanded frequently asked questions, and posting that to the website with all the webinar materials. We are out of time. We could have done this for another hour. Thank you all so much for attending, and thank you so much for everyone who's contributed to this effort thus far. There is more to come. You'll be hearing about our progress later on this fall. Thank you all and have a great day.